I didn't know that was going to be played today. And we were told that Brad Pitt was going to play Andrew's role and Jason Statham was going to play mine. I don't know what happened. We also promised to wear costumes. Andrew decided to go with a Frankenstein shirt, and I'm wearing my wolf mask. Yeah. How many of you have been present for one of our presentations in the past? Everyone in here, basically? So not everyone. So I'll give you guys a quick introduction to who we are, and then there we go. Asked to talk about current fraud trends that we're seeing here in Nevada. So we are the Medicaid Fraud Control Unit. I shouldn't just say us. There's 20 of us in the state. Andrew is our chief. I'm the deputy chief. Andrew's a prosecutor. I'm a criminal investigator. We have a number of criminal investigators. I think we have 9 criminal investigators. We have a couple civil investigators, and then we have criminal and civil prosecutors that handle all of our cases. We work in a task force model, so it's not like a traditional police department where the sworn law enforcement go and put together a case and then email it to Andrew or his attorneys and say good luck and never talk to them again. We work it like a team. So from day one, I'm paired up with the attorney that's going to prosecute the case, and we work the case together all the way through from beginning to end. So there's a great deal of satisfaction in that. I get to learn a lot about the legal system, but also I get to see a case through all the way to conviction and sentencing, where when I was a patrol officer, that didn't generally happen. I'd send a case off and I'd never hear about it again unless I did it before. So we get to see these things all the way through. Our main goal is to investigate and prosecute Medicaid provider fraud. So not the people who are on Medicaid who are getting the welfare benefits, the actual providers, the doctors, the hospitals, nurses, psychologists, the actual healthcare practitioners who are lying about the services that they provide, or lying about their qualifications to get into the system, which we can talk a little bit about if you guys have questions on that. But that is our main goal. In addition to that, we investigate and prosecute instances of elder and vulnerable person abuse in boarding care facilities or in a private residence when there's a Medicaid funding nexus. So a good example of that, the healthcare facility, it could be a skilled nursing facility, it could be the hospital itself, it could be a group home, an unlicensed group home, we do cases like that. And then on the private side, if grandma is a Medicare recipient or a Medicaid recipient, she's getting personal care services, and that PCA is coming in and punching grandma in the face or abusing her in some way, those are cases that we would also investigate. So those are our main 2 things, but in addition to that, we have a responsibility to police the entire Medicaid system. So if there's something going on within Medicaid, either one of the state employees or maybe one of Medicaid's contractors is doing something fraudulently, we would be responsible for investigating that as well. That doesn't happen a lot, but it has happened, particularly with the contractors, where they were in cahoots with bad actors, and there was some money exchanging hands so that people could get pushed through the system faster and become providers who should not have been providers in the first place. So I'll move on to our next part, unless you have anything you want to add.
No, just really quick. And I apologize, everybody. I literally just got back from Disneyland yesterday. I had way too much fun. I'm not going through puberty. But it is that good. And I just wanted to thank Diego because, in my 20 years of doing this work and doing outreach, I've never had to follow myself. And so this is odd in having to have that. But this is kind of obviously different. We really wanted to have this presentation be more what we're seeing in fraud that's going on right now. So unfortunately, in a lot of these scenarios, we don't have the final answer yet of essentially how our investigation played out, or obviously the convictions or the end results of them. But we wanted to basically really show essentially what we're seeing and dealing with really right now in the Medicaid fraud world. So.
You want me to talk more?
No, you can go.
So for probably a decade and a half now, the vast majority of our cases have been mental health related. So mental health providers lying about the services that they actually provide. And they would literally just jump from different procedure code to different procedure code. And as Medicaid would crack down and tighten up the policy on one procedure code, they'd move to the next one and then build that one abusively. That has since changed. So we're getting a lot less behavioral health and mental health referrals and allegations to these few schemes that we're seeing now. So the big one that we're working right now is allergy testing and immunotherapy in conjunction with community health workers. About a year ago, Medicaid reached out to us and said they'd identified a scheme. And there was 20, it grew to about 25 total different companies who were billing the same pattern. And it was, there'd be an allergy test administered, and then there'd be these immunotherapy. It'd be the preparation for the allergy immunotherapy. So the little vials, they were supposed to be preparing those, and then the people can administer it to themselves, or the doctor can administer it to them. But we weren't seeing any administration codes for that service. It was just the prep, which is allowed by Medicaid policy, but the amount of it was suspicious. So there'd be those codes in conjunction with a community health worker code called the Education and Training. And it's a pretty blanket code. It covers a whole bunch of stuff, but it has to be provided by a community health worker. And the billing was outrageous. Way more than 24 hours a day of this stuff. People were getting allergy tested like every week over and over and over again. It was just ridiculous. So they sent it to us and we started doing some work on it. I think we're up to 30 companies right now, and we've identified, I would say, probably 3 main groups that are behind all of it. Now, on our last presentation, we talked about consultants and how there's these people who offer consulting work. Come to us and we'll help you start a Medicaid provider company. And that was generally in the behavioral health field. They've since moved on to becoming provider type 20s or 24s, so physicians or nurse practitioners. And they'll convince these physicians or nurse practitioners, they'll sell them the dream. Hey, I've got this allergy testing program, or I've got this community health worker program. Partner with me, I'll come in, I'll bring all of the staff with me, I'll even do the billing for you. You don't have to do anything, I'll just pay you. And all I want is 10, 15, 20% of whatever it is. So they sell this dream. They tend to prey on young nurse practitioners right out of school, or elderly physicians who are on their way out and want to retire. And they want that extra money so that they have that before they retire. So that's what we've seen the pattern is. Now there's some in between who are just bad doctors who just want to make cash who are younger. But that's what we're seeing is they're targeting people who either don't know because they're brand new, or people who just want that extra cash before they retire. And so they, go ahead.
Well, I just wanted to point out, and again, I think the beauty and the curse of Matt and I doing this for so long is we've really seen how the fraud has changed over the years. Because when we first started working behavioral health, I think 2008, 2009 was our first conviction. You know, it was really people getting into the industry, opening up a business, you know, obviously having some workers, but just doing random fraud. But there was little oversight. We still wish there was more oversight. But as Medicaid started clamping down and really started addressing some of the fraud, they started putting in more requirements. They started putting in like things like checklists, like forcing the providers to disclose like who your biller was. If you had a consultant company, who did you use? But as we've seen over the years, when Medicaid starts clamping down on a code or a provider type and starting to essentially clamp down on the fraud just moves. They don't go away. I mean, that's not good for our job security. So it's good that that happens, but they just move on to a different code, and that's what we've seen. So now, as Matt said, we're seeing essentially our behavioral health actors move more into these physician types, the nurse practitioners. And I think the wrinkle and problem for us in that area is like, some of these people are actually enrolled legitimate providers, well, they're claiming to be, and that's how they're selling this dream, they're selling this story, which is different from the quote-unquote consultant companies, which if you just find out who's really behind them in Google, you can find out these people are, the reason they're consultants is because they can't be with Medicaid because they're either excluded or convicted or been cut out. So this is kind of how the fraud has gone to, but as Matt mentioned, you know, these community health workers, like we're seeing a tremendous explosion in the amount of fraud done by CHWs, that we call them. And one of our major cases that we're looking at is one person that has a harem, is what we're calling it, of CHWs, and she, during her day job, is a professional stripper.
Night job.
Night job, exactly. Day job, she's puppeteering these CHWs. But good news, last week she got arrested for some other crimes that she was doing that Metro got with, but we're going to get her on ours too. Trick roll, of course. But we literally, the week before that, so just 2 weeks ago, she posted a video on her TikTok or some social media, and she's got a stack of $100 bills like this, and is just fanning them out like that. And these are the people that are in Medicaid now as quote-unquote providers. She's not, because she's got a criminal history, obviously, but she's puppeteering all these CHWs that are going out into Parampur, really just setting up a laptop in a park and trying to get Medicaid ID numbers. And then they're selling these client lists to these clinics that are doing allergy testing and doing some of the, obviously, the incredible amount of fraud we're seeing. So that's just how we've seen the fraud kind of morph and transform over the years. This is where we're seeing it going now.
And Andrew's right when he says it's some of the same exact actors that were hitting the behavioral health, but like there's one group that's puppeting some of this. Right now, there's a woman involved who, about 15 years ago, our unit investigated and convicted for PCA fraud. It's just they don't seem to go away. They like to come back. The money is too good. So they keep coming back. They just keep finding ways to get into the system under somebody else's name. And she's really insulated herself well.
And now I have to use this as the segue because much like these providers that we convict and we think are, left for dead, they keep coming back to lie with these other various body parts and things like that. It's much like Frankenstein.
Well done.
Thank you.
Well done.
Thank you. I had to get it in there somewhere.
The other code that we're seeing them exploit a lot with these companies is this electrostimulation. So it's like the device you can order on Amazon right now that you put on your muscles and it electrocutes your muscles. It's the exact same thing. And they're doing a lot of this out in Pahrump. It has kind of seeped into Clark County a little bit, but the vast majority that we're seeing is out in Pahrump. And the way they're getting recipients is they are literally going to where the homeless congregate and offering them $25 a week. Almost every single person that we've talked to, Medicaid recipients, said the exact same thing. I met her at a park in Pahrump where the homeless people hang out. She said if I gave her my Medicaid information, she'd give me $25 a week. All I had to do was show up to their office and sign a sign-in sheet. Every single one of them said it.
And then one of those CHWs drives around every week and does the delivery. They call it donations, but it's a kickback. It's cash.
It's 100% a kickback. Yeah. She's literally, most of them are paying these recipients just to sign up. Which you think would make it hard for us to get the recipients to cooperate and be willing to work with us, but it's been the exact opposite. They aren't getting any service. Most of them don't even realize that they're being billed. Medicaid very rarely sends out an explanation of benefits to Medicaid recipients. There's like a very small percentage of people that they send it to every year. The reason for that, a couple of reasons. Medicaid recipients are notoriously transient. They're moving all the time, one place to another all the time, so they're very hard to find. Not only that, but they don't really answer their email or their mail when they send it to them. So if they send them an EOB, they do it to say, hey, check this EOB, make sure you got these services. I want to make sure. Very rarely does anyone ever respond. So they don't do it a lot. It seems like a waste for them. So these Medicaid recipients have no idea what's being done. They think they're getting a donation, that it's a nonprofit group that's helping them out, and they don't realize that their information is being taken from this company to another company to another company. And just like the consulting companies that we've seen in the past, they do the exact same thing where they have like a bank of Medicaid recipient information, and as one company gets suspended by Medicaid, they have another one ready to go, and they just move those people into the next one and move them under the next one. This has become such a problem that it's not just us that are looking at it. The FBI is very involved in some of these cases with us. They have criminal informants out there in Pahrump right now who are feeding us information about what's going on out there, as well as the OIG. In fact, we went out and talked to the people in Pahrump. We went out in force. There was like 8 of us pairs, so 16 of us probably total, went out there and interviewed as many people as we possibly could to get this done. So it's a very big deal right now. And at lost amounts, we are in probably like 30 plus million that we're looking at. And they are still doing it. They are continuing to open new company as Medicaid tamps down on them. Unfortunately, we're not going to be able to get all of those companies, but we are targeting in on the players. So we've done the bank analysis. I just got it yesterday for all these companies, which confirmed our suspicions that there are essentially 3 main groups that are behind this. And we're seeing if Andrew was a nurse practitioner and they convinced him to sign up, he'd get some of the money, but the vast majority of it is going to these people. And you can see it in the bank records, so that's how we're able to track them pretty well.
And you have to remember too, like when we go out and talk to these recipients, they're getting maybe $20, maybe $40 a week as part of this scheme as their donation. And as Matt said, sometimes that can be, it's like, well, they're getting money. I don't know if they're going to go cooperate with us or they're going to, oh, thank you.
Sorry.
Because y'all last like 5 minutes if I go like that. Yeah, I mean, obviously when we go out there, and we hope that they're going to be the best, but obviously we also go out there with the claims in hand. So if we get a sense that this recipient isn't being exactly forthcoming and is not sharing all the information that we think we know, we'll go ahead and bust out those claims and say like, well, just in case you were wondering, you might be getting $20 or $40 a week, but the clinic that's billing for you, they're making $20,000 or $40,000 a week off of your name and number. Like, what? And then they feel like they're getting ripped off and they have their just desserts, and then they quickly switch sides to us. But that's part of the problem, is the recipients are very much I mean, it's in unfortunate nature, have Medicaid recipients, they are in need of them, they like the money, they need the money, and it's a quick and easy thing. If all I gotta do is sign a paper once a week, sure. But then the problem with it, especially these allergy testing things, because I prosecuted a pediatrician a number of years ago that was doing fake allergy testing, and she went as far as to put the fake allergy test results in that in a child's file, medical file. Well, if that child moves and then that medical file moves, now you have all these bogus, like this kid might actually be allergic to grass or hay or something like that. But this doctor didn't care. She just literally said, I'm not allergic to anything, zoop, right, 99 times, because she allegedly was testing the 99 prick allergy testing because it was $1,000 a pop. And it's like, you don't realize what you're doing. And I had a case very early on against a behavioral health company. It was a Medicaid recipient that they had made up all these fake diagnoses to get a higher level of care, and he was trying to get into the military and he couldn't because they thought he had all these mental health issues, and he didn't. And we had to actually help write a letter basically saying no. I mean, he was unfortunately wrapped up in a fraud scheme, but that's what these fraudsters don't care about. They just in it for the money, but the ripple effect they're creating for these recipients, especially if they're trying to try and to get in an industry that there's a medical record or a background check or something like that done, it's going to affect them, and we've seen it. So.
I think we kind of got through all this, yeah. So that's just some more about this. The groups that are responsible have kept their information off of everything, except for the bank stuff. So they don't actually open the accounts themselves. The doctors and nurse practitioners have the accounts. But as soon as we do an analysis on the account, we can see all of this money going to either their LLCs or to them directly. And it's, when I say large sums, I mean seriously large sums. I just reviewed one of the final reports for one of these cases yesterday. We don't charge money laundering a ton, but it's so easy with these cases because the money's so the easiest money laundering charge in the state of Nevada, stateside, not federally. Any ill-gotten funds, and it's a transaction over $5,000. And it took like 3 seconds for my investigator to be like, here's 10 of them, boom. 10 separate money laundering charges. They're all going to be like Cat B felonies, just like that, because it's so simple to show none of these services were provided, all of the money's fraudulent, and then they're just taking it, sending it to the doctor's account, and then from the doctor's account to the bad guys, and then they're sending it all to these different places to try and hide where it's going.
And we did, a couple years ago, got somebody on 25 charges of money laundering, got her convicted. We charged her 99, because I told my prosecutor we can't do 100, that's ridiculous, so she did 99. And then they took a deal on 25 of those felonies, and she actually got jail time. So it's actually, when we get to that level, the money wasn't insane, it was like $1 million, maybe a couple million, but she also showed up to sentencing wearing Louboutins and the fancy red bottom shoes and all that stuff. Video judged didn't like that because that was also taxpayer money. But the money laundering is the higher level, as I mentioned, that higher level of felony, but again, it also, for some reason, gets more attention than Medicaid fraud. And look, I mean, if we can send somebody away, great. And again, unfortunately, Sean Marshall is her name. Don't know how much really the deterrence factor helped because she did her time, and then her son, who was a rapper, did a music video, and we were named. So, we're in rap and TV. But then at the end of the music video, the son pulls up in his Range Rover at the jail to pick up mom, and she's like, yeah, let's go make some money. Within a month, she had submitted another application to open up another Medicaid provider company, which got caught, good, but that's what we're dealing with. Like, even you send them away and they're doing a year plus, whatever, in jail, prison, the money's still so good, and to a certain degree, it's so easy to get in and get access to it, they're not going away, they turn into consultants.
How much a year would be lost to the taxpayers and stuff like that?
See, that's...
Lots. So this group, the 20 to 30 companies, only operated for like a year and a half. And we're talking probably 30 million plus. And they're still opening new additional companies. The problem becomes, there's 20 of us in the whole state, right? And that's not 20 investigators. It's mixed between investigators and prosecutors. And we can only work so many cases. So it's hard to address every single one of them. So we try to hit the big ones. And then, honestly, what we're trying to do on this one, just like we did on the Larry against the Carter one that we talked about before, is go to the owners, these nurse practitioners, and these doctors, and which ones are going to be willing to essentially roll on the higher ups in this organization.
Girls that spearmint right.
Yes. Exactly.
we'll set up an undercover operation there. No, I really do think though, and again, it's still early, so we don't know yet, but curbing a lot of this fraud, we have somebody here we can thank for that, because Assemblywoman Edgeworth is here. AB 315, which just got passed this past July, which really strengthened the provider application process and put in these live scan, and really just further enhance the ID requirement to make sure people getting into the system are who they say they are and are really affiliated with this company. But the other huge fraud problem we have is on the individual side provider level, that these individual providers getting associated or tagged to these group companies and then having all this billing going in under their name and number. And much like Matt was talking about the recipients, these providers don't have an EOB either. They don't necessarily know, unless they're policing their number and going to the portal and checking, what companies are really billing under them. So with this live scan, which again, I think it's this month, even though we're at the end of it, and I know they were rolling it out with certain provider types, but we had heard it was supposed to be this month or next, it's going to be applicable for all provider types. So we really do hope that's going to curb a lot of at least the really bad actors that are going the real fraudulent means. We're still going to have some funky ways people are going to get in the system, but at least we're making it harder, which is a huge first step, I think.
All right, so I believe the last time we spoke here, we talked about how California had warned Andrew about hospices. And California had a huge hospice problem, so much so that their legislature put like a 2 to 3 year moratorium on any new hospice enrollments in the entire state of California. They warned us that it was coming our way. Now, I should say the vast majority of people on hospice are Medicare beneficiaries, and so we didn't see a lot of it initially. But more recently, we've been seeing more of these allegations that hospice companies are a problem here in Nevada. We did meet with Ross and Neil last year because they wanted to complain about how there's been this explosion in hospice enrollments, or hospices opening up here in Nevada. So much so that when I look at the numbers, I'm like, there's no way that there's that many people dying here. And so the scheme here, a couple things. Generally, they are going out and selling themselves as home health care, not as a hospice company. So when we go and talk to these recipients, and I'm like, hey, what is your terminal illness? Which you think would be an uncomfortable conversation, but I'm used to that. They're like, what are you talking about? I don't have a terminal illness. I don't know what you mean. So they're always surprised to find out that they're dying. And I have to break that news to them.
Dr. Ross. Yes.
But that's what they're doing. They're getting these people to sign up for hospice thinking that they're just getting home health care and that it's a nice thing that the government provides to them through their Medicaid insurance. But that's not what it's for, right? Hospice is meant to provide end-of-life care for people that have 6 months or less to live. That's what it's supposed to be. There's supposed to be a certification of terminal illness in every one of their files showing you have 6 months or less, 6 months or less to live, and the doctor's supposed to sign off on that. And so we're seeing doctors sign off on those things when the diagnosis that they're listing isn't legitimate, to show that they have it when they don't actually have it, and then billing Medicaid like crazy. So they're falsifying the documents, they're falsifying their diagnoses, they're paying facilities kickbacks to go in and then sell their hospice to the people in these facilities so that they could go into a skilled nursing facility. Now I should say, we are not seeing the kickbacks going to the facility itself. They'll generally go in and say, hey, can I talk to the director of nursing? And they'll say to the Don, I'll give you $50 a head, let me go sell my hospice to these people. And they'll sell it as, I'm gonna come in and meet with you, we're gonna send a chaplain to talk with you, all the stuff that hospice can do, but people don't know enough about healthcare to know what the hospice is supposed to be doing. And so they sign up and they don't think anything of it. Same thing with group homes. We'll find hospice companies linked up with group homes, generally unlicensed group homes, and they're paying them the kickback too to provide hospice services, yes, in quotations, to the residents of those group homes. And those people aren't dying. They just make it seem like they are.
So this must have some physician, unlike the allergy.
Yes.
It's got to have a lot of
Yes.
physicians
100%.
involved.
And-
How can those physicians be that big of knuckleheads?
Well, so a lot of what we're seeing is it's the director the medical director at the hospice. And so that guy is signing off on it.
Exactly.
That's a doctor.
Yes.
Exactly.
Yes, but I don't want you to think that there's like 300 doctors in Clark County that are doing it. There's going to be a few.
299.
Why did you trust?
Exactly.
But are the doctors signing off on just fraudulent records that look good, that look like it's legitimate?
So that is not been our experience. It's just they're just signing off to get them into the hospice.
how do you measure your performance?
Our performance?
Yeah.
I'd say like 50%. I'm not that great. I don't know.
We try.
We do what we can.
We've never lost a trial.
We've never lost a trial. I guess that's good. He's the boss. I'll let him.
No. No, I mean, obviously, when we charge a case, it's there. I mean, we're not like, no offense to the district attorney, throw it against the wall and see that it sticks. Like, we have the evidence, we know it's there. But I think, we really have to look at it, and honestly, I hate to mention it again, but nurse practitioners is the other huge problem in hospice we're using. The nurse practitioners are somehow signing off on some of these assessments, and again, I think the problem we're seeing is the schemes, because literally just a couple weeks ago, we were talking with the Fed OIG, because again, they've been dealing with a ton of hospice on the Medicare side. And it's gotten to such a level that the rumor is that Dr. Roz is thinking of using CMS to put a nationwide moratorium on hospice enrollment. And that's rare. I mean, obviously we've seen it on a state-by-state basis, as Matt's mentioned, California did it. But that would be something coming from a national perspective. I don't know if you've really seen that. So that'll be interesting if they do it, but it just highlights that that's obviously from a national perspective, they see it too, the problem with hospice. And I think, as Matt mentioned, I mean, the problem that we're seeing is a lot of it is being phrased as home health. It's hospice happening in the home. And like, we're working a case right now that 90% of the hospice population that they're billing for, and we're talking $40 million, are patients between the age of 0 and 18. And some of these 6 months olds for the hospice diagnosis as a failure to thrive, I'm like, they're 6 months old. Like, do they know what thriving is yet? But that's the level of what we're dealing with. And again, just to make sure that we're not missing something, like there's not a reasonable explanation for this. Last week we set up a call with the OIG and sent them all this claim data to say, look, I mean, is it something we're missing? And they're like, and this is the OIG agent based in California, so she's been doing it for 15 years, done it. She's like, I've never seen a case with hospice with kids, so you've got a live one there. But that's the kind of the level of what we're dealing with.
How come the claims don't get rejected when they're submitted to?
You want me to say it so you don't get in trouble? I'll say it so you don't get in trouble. The claim system that Medicaid uses, so they contract with Gainwells, their fiscal intermediary. They could put edits into the system to stop a bunch of this. Like the easiest one to us that we've been saying this for years is put an edit into the system that for time-based procedure codes, one provider can't do more than 24 hours a day of service, right? That is just common sense. A therapist can't do 75 hours of therapy in one single day. No, the answer is no, we're not doing it. No, we're not doing it. And I don't know if it's a money thing or Gainwell tells Medicaid we don't know how to do that, but there is 100% a problem with the claims editing system. That I mean, that's way above my pay level, but that's my opinion. Because I do think that they could do more on the back end.
Yeah, no, I second that. And I would just add the other part about it is, and I don't think Nevada Medicaid's alone, I think a lot of Medicaids are set up this way. It is so provider friendly in the sense that they don't ask questions at the onset and would rather just pay out questionable claims. And if there's problems with the claim later, they'll try and recoup it later by sending it to us to try and be the bad guys, or they'll try to administratively recoup it. But it's that pay and chase model is really what it comes down to. Medicaid is not screening things at the inception and instead just trying to run after the money later. And again, I think the big change next year, because 2026 we're already here, when this state switches to a managed care model, where 90% of our claims and services are run through managed care, the fee-for-service side is really just taking even more of a back seat because now they're going to be even less involved. But obviously the fraud is still there. The vast majority of our referrals we get are on the fee-for-service side, which is only allegedly right now 25-30% of the Medicaid population. So it's still going to be there. But we just had our annual in-person meeting with the managed care organizations last week. We met the new one, CareSource, that comes on in January. And basically Matt and I's message to all of them is like, we expect to be hearing from you more next year. There's no way that there's not fraud happening within your systems. I know there's some MCOs that feel like they've solved fraud and it never happens again. But that's just not the case. There's always fraud. There's always going to be some way people manage to get their way in. And we want to be a resource for that. And especially those that are going out into rural Nevada, CareSource and Silver Summit, that have obviously never had managed care in the rural. As Matt mentioned, like we got in that video highlighted, we got a lot of fun in Caliente, which is a lot different than your urban Nevada population.
Well, I'm confused because you mean Republicans say there's fraud and abuse in the Medicaid system. I guess I was wrong. I mean, give me a freaking break.
It's rampant.
Talking about keeping the government shut, and there's no fraud and abuse in Obamacare and Medicaid?
Medicaid money's still being paid out
I
there.
must be getting
The providers need their money.
To grade ourselves, I don't know how to give us an actual grade,
A+.
but last year we had more convictions just last year than we've ever had.
41.
So we had 41 convictions last year, which is more than our unit has ever had in the history of the unit. Don't expect record-breaking numbers every year, but so I do have a goal for our investigators, and they're aware of it, and I reminded them of it. We would be up there with like California levels, and they'd have like 500 people.
How many jail time statistics on that?
So I can tell you that we very rarely get jail time. Generally, the only jail time we get is on abuse and neglect cases, so when someone's actually hurt. We recently had a lady go to prison for like a year and a half because she was running an unlicensed group home, and the place caught on fire during 4th of July a few years ago, and one of the residents died, and so we were able to convict her, and the judge sent her to prison. He mentioned Shauna Marshall, who was wearing Louis Vuitton. So the judge will send someone to jail or to prison when they give them attitude, or when they show up and are totally unremorseful.
Or we did have one last month, Ariel Dick, so I think we've talked about with Larry and Lisa Carter. So she ended up taking a plea deal. We actually charged her in 3 different cases, so 3 separate criminal cases. She took a deal with all of them, like a global resolution. It's like
$7.5 million.
yes, I was going to get the exact dollar amount, but it's $7 million. But she did get prison time on that. And what kind of helped is she's currently already in prison in Arizona. So we're just going to send down Con Bus to pick her up when she gets out and ship her back here to Nevada. And then she'll do some time here because obviously her attorney was like, well, she's already doing time. I'm like, yeah, in Arizona for the crime she committed after she committed the crimes here. Like she's not getting away with not doing time here. So she is going to do time in 2027 when she gets out in Arizona. So. But it takes cases like that where we're able to show millions of dollars and obviously schemes throughout multiple different companies. The one-offs, we're just not getting it.
She'd also been convicted by us.
Yes.
Like 5 years ago.
Yes.
Doing the same
And got
thing,
probation.
And got a slap on the wrist.
Correct.
And then did it again.
Yes.
With a whole bunch more money and a whole bunch more companies in Arizona and here. So I think that also.
That helps our jail
The judge
time.
was like, you've
Yep.
done this, you knew better, you're going to prison.
100%.
Okay, so wouldn't mandatory minimum sentencing a law that would require that?
I am so glad you
Beautiful.
asked that.
I would
So,
be beautiful.
2 of the people that you saw, Apostle Greg Kirby and his wife Carol Kirby, they ran multiple mental health companies here in Las Vegas, and they had their family and members of their congregation doing the same thing and getting a percentage. We worked that case. There were 13 different defendants. We worked that case with the feds, with the IRS Criminal Investigation Task Force, and allowed the U.S. Attorney's Office to handle the prosecution. Started that case in July of 2017. This year, finally, the last defendant took pled and was sentenced. Of the 13, I think 3 actually got prison terms. Everyone else did not, despite the mandatory sentencing guidelines. And I'll tell you how this works, because I go to every single sentencing hearing. I like to see them take responsibility. But what I see all of them is they stand there before the judge and plead their case of, I didn't mean to do this, I'm sorry, blah, 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 blah. I have a sick grandma, I have a sick kid, my daughter's autistic, this, all of any possible reason you can think of to not go to prison. And then every one of those federal judges was like, I feel bad for you, you're right. So you don't have to go to prison, you just have to do some probation.
Yeah.
Yes.
A comment and a question. So the comment is, so the crime does pay.
100%. That has been
We
my
can't
experience.
advertise
Yes.
that, yes.
Crime pays.
Yeah, how much do you steal?
We do not have a threshold on our cases.
$650.
But the actual question is, debate, you had mentioned the NRS prohibits you guys from doing proactive investigations.
Right.
So not the NRS,
federal grant.
We're funded by a federal grant because Medicaid is a quasi-state and federally funded program. A federal grant pays for 75% of everything we do. And they have made it a part of that grant that we are not allowed to be proactive and like go into the data and say, okay, here's the top 10 billers for allergy codes. Let's look at the top 2 and see what the problem is there. Why are they such outliers? We can't do that.
So what is the common sense or no common sense, the federal government, reason for this limitation to actually prevent fraud?
Great question.
So it's going to sound stupid, but that's the feds. So basically how the feds look at it, so there's a whole division within Nevada Medicaid called the Surveillance Utilization Review Unit, and they do the data mining. And essentially they're our biggest fraud referral source. They give us a lot of our time bandits. But how the feds look at it is we're already paying a unit to do what you want to do in data mining, so why would we pay you all twice? So there is a way to do it for us to do data mining. It's essentially getting a waiver as part of our grant. You have to essentially show like a certain level of hardship. A lot of it is MFCUs. Like we're very fortunate. We have direct access to the Medicaid claim system, so we can just go in there and run claims. Some of the MFCs across the country don't have that and are having to do like formal subpoena type requests to get claim data, and that gets to be unwieldy, and so sometimes they'll get that waiver just so they can get access. We're just not there yet. We've got a tremendous, obviously, relationship with Nevada Medicaid for referrals, and to a certain degree, we're at a point where we're unfortunately already turning away good referrals just because we're 20 people, and that's probably the next step is to really expand the unit. We had to get some budget stuff straightened away this past legislative session, but now that that's kind of done, we need to expand because we're just turning away too many good cases. But it's a great point, though.
It's a great meeting in terms of information, but how do you get visibility in terms of what you're doing to the public?
Definitely events like this, we appreciate it. Every conviction or civil settlement, I try to get our Attorney General to send out press on it. He started getting tough on crime about 6 months ago, so we'll probably start seeing some more press releases come out in that vein. But we put everything on our own website, though, all of our cases. So even if the big office doesn't put it out on press, through the AG's website, we have our own page, and we put all of our case results, all of our convictions, the civil settlements that we do against some of our bigger cases, we put those up there. So we at least try to get out it that way. But a lot of it is events like this, getting out into the community, outreach, just so at least they can hear from us about how we operate, what we do. And we've been very fortunate through Game of Thrones, through Sunny, the governor's office in the back, to be able to really set us up and get us in front of a lot of great people. But it really comes to that because the rest is to rely on our big office, and that's getting this in all my 5 AGs.
More recently, we've been trying to get in with the local healthcare programs.
Yes.
So we teach at Toro University 3 times a year. We did UNLV earlier, and then we did UNR's nurse practitioner program a month ago. And then next week, we're flying up to UNR to speak at their nursing summit.
Yes.
So we're just trying to get us out there, telling
Exposure.
about Medicaid fraud. Because that's what we see a lot is people don't realize the extent of the problem or in how much danger some of these providers are in about being taken advantage of by some of these bad actors.
You know, with the Medicaid MCOs, what are they doing about this? Because they're on a set fee.
Yes.
The more money they can save, obviously.
Yes, so every MCO has its own special investigations.
Okay.
And I love them. I think they're great.
Okay.
There's some intricacies thing that are weird about it. A lot of them are not based here in Nevada. So their investigators will be spread out throughout the country. They work from home. They do mostly data work. They're looking at data, they'll request records, they send that stuff off to clinical staff who do the review, and then they'll send out a recoupment request or say, hey, you did this wrong, you need to fix this, or place these providers on prepayment review, which in Medicaid's defense, they are trying to set up and get that going.
Trying to.
So they do a lot of work, and they do catch some things. The problem that we see with it is they cover so many people of the Medicaid population here in Nevada, there should be way more criminal referrals. And our opinion isn't that those investigators are doing things improperly. It's just I think they have a culture or a system in place at those places where they don't want to admit like we have this big fraud problem because it could affect the capitated rate in their contract with Nevada Medicaid.
Yeah.
So there's pros and cons to it. They are 100% a force multiplier because they're looking at the same stuff we are. It's just, and we have spent years developing relationships with them. So there's some that are really close with us. Melina's great. Anthem's pretty great. Silver Summit, so-so. HPN's been a lot better in the past year or two. It's just developing those relationships so that they trust us. And one of the big problems we see is they have relationships, or they should have relationships with Medicaid fraud control units in other states as well, because they don't usually just cover one state. So like one investigator will have Michigan, Nevada, Oregon, right? And they'll tell us horror stories like, I can't even get on the phone with those people. Where we're freely offering, like, here's our cell phone number. You have a question, give me a call, and we'll consult on any case you want to talk about. So you don't have to spend hours writing up this credible allegation of fraud referral to send it over to me if I'm just going to be like, look, I don't have the people to work it. Don't send it, right? So we do what we can to try to facilitate those relationships and make it easier for them to send us referrals. But it's taken years.
Yeah, I just had last week, again, I mentioned, we were at that managed care meeting, and, we had our little spiel, we expect to hear more CAS, but honestly, before we can even get to that, Medicaid themselves was telling the MCOs, look, you guys need to do more in referrals, and especially these credible allegation of fraud referrals that come to us, and they're trying to use CMS and their audit that they went through a couple years ago to say, that was something we really got dinged on, and you guys need to do better and get more referrals out. And I think our frustration in that regard with Medicaid over the years, it's like, okay, it's good for you guys to be saying that, but at the end of the day, you have the contract with all these managed care entities. So if they're not doing it, then you got to utilize some type of contractual provision or something like that to force the issue. Like, I think we've done enough playing nice. And I think it's now time, especially again with the switch to managed care next year, that we make sure to hold managed care accountable. Because we know fraud is happening, and to a certain degree, when we see some of these cases that managed care is working, we look to our, in fact, last week, we're looking at ourselves like, how is that not a referral that's come to us? Like, that is blatant fraud. Like, they were giving us a scenario where Liberty Dental, which Liberty's great, we like them, but they were telling us a scenario where they caught a dentist that essentially was doing 2 versions of an x-ray on the same day, but then splitting the billing to do it over separate days, because if they would have billed the same day, it would have gotten caught, or should have gotten caught and denied, because it's just one of these codes that you can't bill 2 x-rays in the same day. And so Liberty was like, yeah, so he went to the dentist, and the dentist is like, oh, my bad, yeah, I'm sorry, that was a mistake. No, that's what we call unbundling, that's fraud, but you guys just gave him a pass, and that's not something I think we should be doing. Or if you're gonna give them a pass once, they do it again, then there's no mistake here. That's intent, and that's knowledge, and that's crime. So I think there's gonna be more of those conversations, especially next year, because I think just managed care needs to be held more accountable. Yes, Doctor.
So just briefly, thank you so much for what you're doing, because it is truly a game of whack-a-mole what you guys are doing. Desperate people will make desperate choices. I will say on the hospice, besides AB 315, I had AB 161, and I wanted it to go a lot further, cracking down on bad actors. They were providing terrible care to people who are dying. Like, that's pretty terrible. But it got watered down. They are supposed to be provided with a Bill of Rights upon being signed in, so presumably they would at least know that they've been signed in to hospice. It's required. I hope.
If they give it to them.
I don't know, but
I get it.
why it was watered down, because I wanted it to do so much more. The reason we were told is that it's complaint driven. A lot of it is complaint driven, and the people who don't complain are people who are dying, actually. So the more we can complain, when we see things that aren't going right with hospice, a lot of us see it, but a lot of us don't know who to report it to or who to talk to. But please be proactive and report the things you're seeing. Without reports, there's literally nothing the state can do about it.
Very true.
Correct.
Yes, thank you.
Yes. Oh, that's a great question. I'm going to skip ahead, but I want to talk about wound care before we leave. So we will take all of your complaints and referrals. That email address right there is the easiest way to do it. That goes directly to me, Andrew, our intake team. Every 2 weeks we review those referrals. You can also call Andrew or I, and those are our phone numbers there, and our personal email addresses. But then also that phone number underneath the intake email, that goes to our intake team. So we have an intake team member here in the south and one up north. Doesn't matter who you talk to, it will get to us, and then we will determine what to do with those referrals when we get them. So that's the easiest way to do it.
Ghost face.
I should say, you like the ghost face?
It's a corded phone.
Yeah,
It's not
cool.
It's old school.
I do want to say, so there's only 20 of us, so we can't take everything, but almost every single referral we get, if we can't work it, we will send it to someone who we think can. So let's say you send us a hospice referral, and there's no Medicaid exposure, it's all Medicare beneficiaries, we will send that directly to the Office of the Inspector General, who handles Medicare fraud investigation.
if we're all complaining and you can't do everything, it would at least make a case for expanding your department.
100%.
So I
That's
track
what we're doing.
our referrals, and I put in there, we can't open this case because we do not have the resources.
Yeah.
So I'm tracking that. So in 2 years, when Andrew goes to the legislature, and I hope, and this is wishful thinking, he asks for 5 additional positions, so to expand our unit by 25%. It's gonna be a big ask. But when he makes that, I will have a spreadsheet that says, this is how many cases in the past years that we have not been able to take ourselves because we don't have the resources.
You can show the return you are.
Exactly.
Well, we can show
Yeah,
the
we can
return
do
pretty
that.
easily. The money amount is easy to show.
Yeah, but I think the trend in our numbers, and again, we got a great group, and the trajectory is just going up. So I think that's going to help in a lot of these arguments because the legislature is all about the numbers. They don't want to hear a sad luck story. So I think we're going to have the numbers to really prove it, though. So
We're trying.
we're trying.
So real quick, I want to touch on wound care because it has exploded across the country, not just here in Nevada. Here we are seeing it a lot with nurse practitioners. So it's not the actual wound care that's not being provided. They're providing some wound care. It's not a billing for service not provided. What's happening is that there are these manufacturers of specialty skin graft products that you put over the wound. It's generally like pig skin or fish skin. It's associated usually with a Q code. There is not real good policy from CMS or Nevada Medicaid on these Q codes, and they are wildly expensive. And by wildly expensive, I mean, I looked at the Medicaid claims last week on this. The average for 1 square centimeter, now a stamp is 4.5 square centimeters. The average for 1 square centimeter is $1,300 being paid out here in Nevada. It is a crazy amount of money. So what's happening is these skin graft companies, the representatives of these companies, are going to practitioners and teaching them how to do the billing so that it gets approved, teaching them how to maximize the billing, and paying them a kickback to use their products. Or offering, hey, use my product for free for however long, and then later, once you're using it, you're hooked on this money. It's like you got a little bit of cocaine and now you're hooked. Once you're hooked on this amount of money, you'll start billing us. You'll start buying our product. So that's one aspect of it, the manufacturers paying kickbacks to practitioners to use it. The second aspect that we're seeing is those practitioners then going into facilities, and generally going to the director of nursing at those facilities again, and paying them per head of patient to say, I will come in and be their wound care provider. Yeah. So they're coming in and they have a wound and they're putting these grafts on them, charging a bunch of money, paying off the Dons, the Dons cooperating, so there's a conspiracy going on. And the patient might not even know about it depending on their mental state. They might not have any idea that it's a new doctor. And what we're seeing a lot is that person's actual primary care physician has no idea because there's no communication. They have no idea what's happening. They don't even know that they're being seen by a different practitioner. So it is a huge problem. They are 100% preying on nurse practitioners. That's who they're generally going to. A lot, again, the elderly ones as well as the ones that are fresh out of school. And when I talk about, we're getting referrals from people that are not even in the healthcare field, they just know some of these nurse practitioners. And they're they went from being broke, no money whatsoever, to 6 months later spending $3 million cash on a house. That's how fast it is happening.
Yeah.
It's so fast. We are trying to get a handle on just understand it all because it's brand new to us. But California has been hit real hard with this. Arizona as well. I'm sure you guys saw the press release. Arizona had a case, same situation, $900 million in 18 months. 2 of them have pled. They will probably get 20 years in prison roughly, but they got paid $600 million, $330 million in illegal kickbacks. They employed nurse practitioners. They were paying $500 to $1,000 a patient. So just imagine that. You're making so much money off of this, you're able to pay $500 to $1,000 per patient to have them as your person.
That's like $500 million for that patient right there.
It's crazy. Well, that's the pride. Frankenstein.
Oh, okay.
Yeah, you're wearing his shirt.
I got you. I didn't see the hair.
But it's a lot of money. Here in Nevada, we look back at the claims just for 3 years. There's been $16 million paid out, but they billed $255 million. So some of it's being denied. And then of that $16 million, there's 4 main providers that I see on the claims data doing it. One of them we were 100% looking at. We have a meeting after this, actually, with the OIG to discuss that case. So we're looking at it. The FBI knows about it. The money is so good that the bad guys know it's bad, and they know that we're looking at it, that the FBI is looking at it. They do not care.
No.
They understand that if I do 10 million in business and I keep 2 million on the side, so that when the government catches me and I say, I'll pay $2 million back, the government, we're broke, we're like, absolutely, thank you, please pay $2 million. They get slapped on the wrist and they're going to get probation. Because no one, generally people are not saying, I'll pay $2 million in restitution, that's a lot, and then actually having the funds. But they do that, they had 10 million total, they walk with 8 million. So yes, crime does pay.
Yeah, unfortunately.
Unfortunately.
Well, I remain confused that these big government programs endorsed by the Democrats don't work perfectly. They got some bureaucracy which is wrong. I guess what I've been told is wrong.
We've all been lied to.
I can tell you that we do everything we can to catch them. We try. And I don't want to say it's like there are people in Medicaid who are just as passionate about this. Stacey Weeks, who was here 2 times ago, she is a champion of trying to put a stop to this, and she's in a great position to do so. And she's trying. The system itself, there are loopholes when there's problems, and so it's really addressing those, trying to make it harder. I think I talked about it last time. In my neighborhood, I have a neighbor who leaves his garage door open all the time. And I never warned him, hey, you should probably close your garage, because when that robber pulls into my neighborhood and sees his house is wide open, whose house is he going to hit? Not mine. He's going to hit that guy's house because he left his garage door wide open. So really all we can do, bad guys are going to find a way to take advantage. Always. They're going to find a way around it. All we can do is throw up roadblocks, close our garage door as much as possible to keep them from getting in.
And I think part of it too is obviously we're very much looking to see how this new Nevada Health Authority and its new structure is working or not working. And I think we've already gotten some initial good feedback in kind of getting HCQC licensing better in line of what they should be doing. So that's always helpful, but they've got a long ways to go. But anyway, we'd like to be a resource and help them in that regard. And I think Diego is trying to get us to shut it out because I think for far too long.
I'm going to leave this slide up if you guys want to look at it. Just don't let yourself become victims of this. Pay attention to who you're going into business with. Do your homework. Do your research. Protect yourself. Be Van Helsing.
That's right. Thank you very much, everybody. Really appreciate it.
Big round of applause. Thank you guys very much. Home run. I'll be honest with you, typically when I go to a presentation, there's 2 speakers, I let out a deep sigh and think, oh my God. And now, like, it's typically 2 people fighting over each other over the microphone. They are probably the best public speakers I've seen work together. A couple of follow-up announcements of what they've been talking about. We've been in communication with Sunny from the governor's office, who's here today, about doing a community cleanup event and helping the community to self-police. I worked in hospice. I knew of marketers that would keep purses and iPads in their car. Doctors all the time saying, well, this company's paying me $500. How much will you pay me? I remember the only person that a lot of skilled nursing would allow to use as a referral service was actually convicted in 2013 of manslaughter. And I didn't even realize it until they did the presentation and put Lenny's picture and name, and I was like, oh my gosh, she's still doing that today, right? And so it's very interesting. So one of the things that I will offer here publicly that came from the Hospice Coalition, because they said, how do we know who's being convicted? So everyone has a copy of the magazine, which you should definitely take with you. In the future, we are going to do a page dedicated to who's been convicted and what was the penalty. So we can start spreading that. We also have 30,000 people that traffic our website on a monthly basis, which and 20,000 of those are unique. So for a regional industry-specific website, we get tremendous amounts of traffic. We are going to start a little section on who's being convicted, who's guilty, who has been convicted in the past, because it seems like they just get convicted and come right back. So we are going to be addressing that. Ladies and gentlemen, I want to thank you, and I want to thank the speakers for another great Halloween edition of Game of Thrones. Keeping in spirit, we are hosting a funeral, our technology task force. Leo, if you want to raise your hand, who leads our technology task force. Tell your CIOs, your technology people, to get in touch to be a part of that. We will be hosting a funeral for Windows 10. So we are planning on that. If you are interested in sponsoring the funeral for Windows 10, Nikki, who's over at the table, Nikki, if you stand up. Nikki is in charge of our events now, so she will be recruiting, speaking to you guys. If anyone's interested in sponsoring a healthcare happy hour, or if you're interested in sponsoring the funeral for Windows 10. Also, check your system. If you don't know any of what I am talking about, you should probably look, because if you have it, it's not going to be supported. Thank you very much, ladies and gentlemen. Have a phenomenal day. Oh, there's also good consultants as well. They're not all scumbags. Carafelli Consulting, thank you very much for sponsoring today. Find the good ones, ladies and gentlemen. The magazine is about human trafficking. We're the number one in the country for human trafficking. Make sure to take the magazine.
That is superb.
I know. These guys are great every time. Hold on. I'm gonna go back. Yeah.
Hi, nice to meet you.
How are you doing, Karen? I'm trying to find their slides with their contact.
Oh, our contact info?
Yeah.
Keep going, you're almost there.
There it is.